We know from NSPCC's research and from our statistics in Northern Ireland in terms of looked after children, in terms of young people who are contacting Childline, in terms of young people who are disclosing to teachers in schools and disclosing to other people, that there's still young people in Northern Ireland, very many of them are continuing to be abused and impacted by abuse.
From our work with children, we identified very significant gaps in their understanding of keeping safe, particularly around the sensitive issues such as domestic abuse and sexual abuse. And many children reported that they felt unsure about how to actually tell and seek help if in that situation. Teachers themselves told us very clearly that yes, they did agree that this was an important aspect that children really needed to have, but that they themselves didn't feel comfortable in dealing with the sensitive material, and they requested a very comprehensive training and support. On the back of that, we have entered into a partnership with the Department of Education to develop and pilot a Keeping Safe programme for primary schools here.
These teachers are the very best people and best placed individuals to deliver these messages. They know the children best, they know how to work with children of particular age groups best, they know the particular strengths and weaknesses of the individual classes best, and they have relationships already formed with these children. And for all those reasons, really, teachers are best placed to deliver Keeping Safe messages.
We have developed a programme of training for teachers to build their capacity and skills in delivering the Keeping Safe messages.
Teachers and whole school staff and parents will have training and ongoing support and resources that have been tailored for them specifically by the teacher who has been seconded to our project, and also by lots of subject experts, and also by consultation with parents and families here in Northern Ireland.
The Keeping Safe project is fundamental in classrooms now, and as our responsibility as teachers grows and for the pastoral care of our children, it's good to know the NSPCC project has engaged with the teaching community to develop the resources. Having a teacher at the very heart of the development of the materials ensures that that teacher knows what goes on in the classroom on a day-to-day basis and understands what goes on a termly basis within the classroom. It's validation for the project, knowing there's an educationalist eye has been engaged the whole way through.
So the Keeping Safe programme is absolutely bringing a very clear focus for a school with the message that safeguarding and child protection is everybody's responsibility. It must be embedded into the lessons that you are teaching children in a school, and you must, as a professional, feel comfortable in managing and dealing and talking about these issues as well. All children have the right to go through their education feeling safe and happy, and not feeling that they don't know what to do if they are in any way compromised by inappropriate behaviour, whether that's from adults or from their peers or anyone else in the school environment.
The PD and MU programme should include education about risks and how children can protect themselves from danger. And I think this is a programme that does address that because of the content and the approach that it takes to the learning.
When the Education and Training Inspectorate inspects in schools, we're not looking specifically for certain things, but we're looking at what the school does. And specifically in this sense, we're looking at how it delivers requirements in the Northern Ireland curriculum. So we're looking at how the school helps young people to overcome barriers, certainly, but helps them to develop the values, the skills, and indeed the resilience to cope with obstacles and to cope with risks that they may encounter in their lives during school, outside school, and further down the road in terms of their longer term health and well-being.
We simply cannot prevent abuse happening by dealing with the symptoms and the causes of it. We have to take a more widespread preventative approach and a public health approach which engages children, teachers and leadership within schools is the best way for us to embed prevention within the school curriculum.